Okay, now we're going to talk about antihypertensives. There are a lot of different drug categories within this one umbrella term. So I'm going to list off the categories just so you kind of have an idea. We're going to go through adrenergic blockers, beta blockers, alpha beta blockers, and alpha blockers, ACE inhibitors, Arbs, calcium channel blockers, diuretics, and vasodilators. So I'm going to show you kind of like my master board that I've been working from. We are right here. We're in antihypertensives, and then all of these drugs are antihypertensives. I know that that looks like nursing implications, adverse effects, but they're all going to have very similar methods of action and so on. So don't get overwhelmed. There are several cards, but take a breath, and here we go. Okay, the first drugs that we're going to talk about are our alpha adrenergic blockers. These are our two drugs, doxazosin and Clonidine. Okay, so we're going to start off with doxazosin. The brand name is Cardura. There you go. This drug is for severe heart failure, especially when it's used with cardiac glycosides and diuretics. And it can also be used for benign prostatic hypertrophy. The classification is that it's an adrenergic blocker, so this is going to turn off the sympathetic nervous system, and it's going to be peripherally acting, alpha 1. So MOA, it dilates the vessels, to decrease peripheral vascular resistance, decrease systemic and pulmonary venous pressure, and increase cardiac output. So venous cooling, and because it acts peripherally. So you see that decrease peripheral vascular resistance, decrease systemic and pulmonary, increase cardiac output, and decrease the peripheral resistance and all of that. It can have the adverse effect of the first dose phenomenon, to drop in blood pressure. That's something that you need to take note of. So when you give your patient the drug, you may want to have them down or even lay down until you know, like, okay, oh, their blood pressure's dropped really suddenly. At least they're not standing and they bump their head or something. Another adverse effect can include orthostatic hypotension. So again, their change when they stand up or whatever. So have your patient sit down. Dizziness, headache, and constipation, and reflex tachycardia can also be adverse effects. And this drug is contraindicated in patients who have an allergy, peripheral vascular disease, peptic ulcers, sepsis, renal, hepatic, or coronary artery disease. So there are a few nursing implications special to this drug. So doxazosin, this drug is a capsule, and the capsule will expel in the bathroom. This is both the immediate and the extended release forms. So you need to let your patient know that, hey, your medicine has been absorbed in your body. Just you have like a little shell capsule left. So they don't need to freak out, and they don't need to dig it out to come show you, like, I still have the capsule or whatever. You just give them a little heads up. Hey, you're going to see this. It's okay. We know that this happens. Because also it's highly protein bound, so you need to monitor their albumin levels. And for this drug, you need to assess allergy history, hypotension, heart dysrhythmias, bradycardia, heart failure, and heart problems before giving this. That's how you spell the name of the drug. Okay, the next one I talk about is Clonidine, which is another alpha adrenergic blocker. Again, this turns off the the sympathetic nervous system. Okay, this drug is for hypertension, opioid withdrawal, severe dysmenorrhea, I can never say that, menopause, flushing, and glaucoma. This drug works with alpha 2. And the method of action is that it stimulates the presynaptic alpha 2 receptors in the brain. This actually reduces the sympathetic outflow. This makes the body think that there's enough norepinephrine available. So it's kind of like a trickster. It's telling your body, hey, we've got enough norepinephrine. You don't need to make any more. You're okay. So it's kind of like tricking your body. There are some adverse effects that go along with this drug that include dry mouth, sedation, fatigue, impotence, dyspnea, Nia, and I always think of her when I do that. Another adverse effect are arrhythmias. This drug can be given topically or orally, but you do can be in. Can't ever say it, but there you go. It's a category B drug, brand name Aldomet. And again, you need to assess your patient's history of any allergies, COPD, hypertension, heart dysrhythmia, bradycardia, heart failure, and cardiac problems. So that's Clonidine, and the brand name is Catapress. I always wonder how they come up with the brand names. Okay, so the next category we're going to talk about are beta blockers, and there are 4 drugs, but 2 of the drugs are really similar, and 2 of the drugs are really similar. So it's really like 2 drugs, but 2 names for those 2 drugs. So the first ones that we're going to talk about are metoprolol and adalimumab. I can never say drug names. Lopressor and tenormin. Those are the brands. And again, this is a beta blocker, so this is turning off the sympathetic nervous system. It is cardioselective for beta 1, so it's going to be working in the heart. These drugs are for hypertension, angina, heart failure after MI or myocardial infarction, dysrhythmias, glaucoma, thyroid toxosis, migraines, essential tremors, and stage fright. So that's kind of a fun one to know that these are stage fright. There we go. There are some adverse effects: orthostatic hypotension, dizziness, constipation, bradycardia, hypo or hyperglycemia. That's something that you really need to know because this drug can mask hypoglycemia. So you need to really take care and take caution when giving this drug to diabetics. Another adverse effect is wheezing. It's contraindicated in patients who have uncompensated heart failure, cardiac block, bradycardia, pregnancy, severe pulmonary disease, and Raynaud's disease. That's the poor circulation in your fingers situation. The way that this drug works, it decreases heart rate, it decreases the myocardial contractility, which is the inotropic, that's the force. Remember, inotropic is force, which in turn will decrease the myocardial O2 demand. It's also going to decrease cardiac ejection fraction and cardiac output. So this inhibits stimulation of the myocardium by circulating catecholamines. This is like a teddy bear protecting your heart. That's what our teacher said this week. She was like, think of these drugs like a teddy bear hugging your heart and just protecting you. So you're going to be thinking of a teddy bear when you think of these drugs. So those are the MOAs. Method of action. You would know that by now, probably. Okay, nursing implications. This is one of the drugs that actually works better in Caucasians than African Americans. I think my teacher said that like they don't have like enough studies that, like just African Americans to this drug, so they just note that it's better working in Caucasians than African Americans. This drug you do need to make before administering it, and if it's less than 60, hold the dose and call the doctor. You never stop at taking this drug abruptly because it can lead to rebound hypertensive crisis, increased fluid and fiber intake to prevent constipation. And again, you need to assess your patient for allergies, COPD history, heart dysrhythmias, heart problems, bradycardia, and hypotension. So remember, these drugs, they're beta blockers. Used for stage fright. And these drugs do mask hypoglycemia. So take caution in giving this drug to, not take caution, but like let your patients know, like, hey, this can mask the symptoms of hypoglycemia. So you need to be like on point with like taking your blood glucose levels. There you go. Okay, next beta blockers that we're going to talk about are propanol and nadolol. I can never say drug names because that's how you spell it. Ingerol and Corgard. I don't know. Okay, again, for hypertension, angina, heart failure after an MI or dysrhythmias. These drugs are non-selective, so they can work either beta 1 or beta 2. It's also considered an adrenergic blocker. And the way that this drug is going to work is that it's going to constrict the bronchioles in beta 2, and it's going to cause vasodilation in alpha 1, and it's going to decrease the heart rate in beta 1, and it's going to increase beta 2 and block glycogenesis in beta 2. So I hope it's not backwards, but we'll have to see. Okay, the adverse effects can also include narrowed airways, shortness of breath, orthostatic hypotension, dizziness, bradycardia, constipation, hyperlipidemia, hyper or hypoglycemia, just like the other beta blockers. This can mask hypoglycemia and wheezing. The contraindications are for patients who have a bronchospasm, pulmonary airway disease, uncompensated heart failure, a heart block, bradycardia, pregnancy, or Raynaud syndrome. Again, that's the peripheral, that's where you have issues with blood flow to your fingers or your toes. Nursing implications, again, measure the apical pulse daily and hold the dose if the apical pulse is less than 60 and call the doctor. Increase fluid and fiber intake because of constipation. Never stopped abruptly because of rebound hypertensive crisis. And assess allergies, COPD, hypotension, heart dysrhythmias, bradycardia, heart failure, heart problems. And this drug also works better in Caucasians than in African Americans. So those are your beta blockers that we were just talking about. All of the beta blockers end in OLOL. There you go. Hopefully that helps. Okay, the next category are the alpha beta blockers. And we have two, Carvedil and Labidol. These end in LOL, which is just like the other ones. It's not OLOL, but LOL. So the brand name, Clonidine. Y'all know I don't know how to say these drugs, but I'm trying. Do I get a gold star for trying? I do. Whatever. Okay. Alpha beta blocker, it's going to turn off the sympathetic nervous system. Again, these drugs can be used for heart failure, hypertension. I was trying to say ventricular. I guess that could work. Left ventricular dysfunction, but that just sounds stupid. So left dysfunction. So these drugs are going to work by decreasing the heart rate, decreasing conduction, decreasing contractility, vasodilating, and decreasing the blood. Decreasing the heart rate is beta 1. Decreasing conduction and contractility is beta 1 as well, because that's the heart. Vasodilation is alpha, and then we just have decreased blood pressure. Adverse effects can include dizziness, diarrhea, static. They need to taper to stop, so they can't stop abruptly. This drug also masks hypoglycemia, so you need to take caution and let your patient know. It can also cause hyper, and you also need to assess your patient's allergies, COPD history, hypotension, heart dysrhythmias, bradycardia, heart failure, and any other heart problems. So those are the other, I guess, beta blockers, but they're alpha beta blockers. They both end. And now I'm going to get into ACE inhibitors. ACE inhibitors all end in PRIL, P-R-I-L. We have, and the brand name is Captain Prevenville. I don't know how to say it. Who knows? Okay, ACE inhibitors. ACE stands for angiotensin converting enzymes. So angiotensin converting enzyme inhibitors. So it's going to inhibit aldosterone. These drugs are not prodrugs, so they're not metabolized in the liver in order for them when dealing with hypertension or heart failure. So the PRILs, ACE inhibitors, are the first line of choice for doctors to prescribe for patients who have heart failure or hypertension, especially if they have diabetes. Adverse effects can include angioedema, hyperkalemia, a diagnostic cough, fatigue, and mood changes. So for hyperkalemia, you need to know your patient's baseline potassium levels. Remember that the baseline, if it's greater or equal to 5, then whoa, hold up. You need to do some steps to lower that potassium level. The way that these drugs work is that it inhibits the conversion of angiotensin 1 to angiotensin 2. So decreasing the glomerular filter, inhibiting aldosterone secretion. So this drug, ACE inhibitors, inhibit aldosterone. Because they're inhibiting aldosterone secretion, there is a decrease in the absorption or the reabsorption of sodium and kidney. So that is going to decrease the heart because the body is able to get rid of that extra enemies by patient urinating. I hope that made sense. If not, just I don't know if I'm making any sense with this. It does what it does. There we go. Okay. Contraindicated in patients who have previous angioedema, pregnancy, or patients who are lactating. So, and in patients who have renal artery stenosis, and patients who have a potassium level greater than 5. Remember, you need to know your patient's baseline potassium level because if it is greater than 5, they're already hyperkalemic, and you don't want to give them this drug because it can cause the patient to hold on to more potassium. So for these patients, you need to avoid potassium and salt and to not change positions rapidly than in African Americans. So here are those methurine. So those are inhibitors. Those are the drugs that end in pril. The next category we're going to talk about are Arbs. These block angiotensin II receptors. The drugs are losartan and valsartan. These are the sartans. So Cozar and Diovan are the brand names. Again, these drugs can be used for hypertension, heart failure, and for people who can't tolerate ACE inhibitors. So remember, with ACE inhibitors, these drugs can lead to angioedema or like a dry, non-productive cough. If the patient notices they have a dry, non-productive cough, or if they've developed angioedema and then the doctor has treated that, then the doctor would stop the ACE inhibitor, and an ARB. This is kind of what they go to next. So the way that Arbs work is that it blocks the aldosterone release. It blocks vasoconstriction because it's a potent vasodilator. So Arbs are a dilator. They also decrease systemic vascular resistance, pain, fatigue, anemia, weakness, UTI, and diarrhea. This drug is also contraindicated in box warning for pregnancy. So here are your adverse effects. So pregnant patients cannot take Arbs. So there's my BB. There's my black box warning and your contraindication. So pregnant, can't take it. Nursing implications are that your patient needs to avoid potassium-rich foods. Remember, so you don't want to say, hey, go eat a ton of bananas or a ton of food. The patient also needs to monitor their blood sugar and avoid drinking alcohol, smoking, or strenuous exercise in hot environments. Patients can take this drug with or without food. They need to change position slowly because of that, or seem to have edema. Or patient have heart because of edema. I hope it makes sense. Monitor weight in edema in heart failure patients. Yay! My words are just not working today. Oh well. Okay, the next category we're going to talk about are calcium channel blockers. Verapamil, diltiazem, nifedipine. That's a fun one. Amlodipine. Okay, I'm just going to hold it here so you can see how to spell the words. Hopefully you can figure out how to say them because I know I cannot say them correctly. Talin, Isopin, Propia, and Norvax are the brand names. Calcium channel blockers, so they can be used for angina and hypertension, as well as tachycardia. Verapamil and diltiazem can be used for dysrhythmias. They can all be used for migraines, Raynaud's disease, and coronary artery spasm, which is a print that stops calcium from moving across the cell membrane, which results in smooth muscle relaxation, which results in decreased peripheral smooth muscle tone and decreased systemic vascular resistance because of that peripheral arterial dilation, vasodilation. Yeah, constipation, nausea, rash, and a potential heart failure. This all is a result of cooling of the blood. So it's not getting returned to the heart, it's just cooling in the body. This stuff can happen. It's contraindicated in patients who are pregnant, who have kidney or liver failure, or who are in mild or moderate heart failure. There are some nursing implications. You don't want to stop this drug abruptly. The patient needs to weigh daily and also monitor for signs of edema or any shortness of breath. The patient should not take grapefruit juice. Yeah, it's like a mouthful. They need to change positions slowly. And this drug actually works better in African Americans than in Caucasians. So good for African Americans. The next categories that we're going to talk about are thiazide diuretics. There's two drugs here. Hydrochlorothiazide, which is hydroduryl. And then metalazone, xeroxolin. I hope that's how you say that. I don't know. These drugs are for hypertension. They decrease plasma and decrease extracellular fluid volumes, which can result in a decrease in preload, a decrease in cardiac output, and a decrease in total peripheral resistance. That's how they work. And there are a few nursing implications. Works better in African Americans than it does in Caucasians. Thiazide diuretics. Calcium channel blockers. Works better in the African Americans than it does in Caucasians. There we go. There's two drugs. Wait, too high? Hydrolizine, HCl, and sodium nitroprusside. Apelzine, nipride, or nitropruss. Great names. Okay. For hypertension, they are vasodilators. They relax arteries and smooth muscle. No way. Decrease systemic vascular resistance and decrease afterload. So the sodium nitroprusside can also be used for hypertensive emergencies. So how, I guess, let's see how to figure out a way. SN, sodium nitroprusside. I'm going to think, okay, and I know on my test I'm going to be like, oh, nitroprusside, hypertensive emergency, 911. It's so stupid. I don't even care. Okay, so adverse effects can include dizziness, headache, anxiety, tachycardia because of the compensation, nausea and vomiting, diarrhea, anemia, dyspnea, nasal congestion, and edema. You can combine these drugs with other drugs, and it's especially good for African Americans with heart failures. When combined with isosorbide dinitrate, which is diuretics, those were good for African. So for antihypertensives. So who knows?